What characterizes this disease? Well, first of all, it's unpleasant sensations, back pain of a bursting nature, shooting nature, aching nature. That is, some unpleasant sensations in the lower back. There is a rise in temperature. It's not always the case, but very often. Still, a rise in temperature is one of the symptoms of inflammation in the urinary tract. Often, with a rise in temperature, chills appear. This is related to the fact that an infectious agent enters the bloodstream, among other things. And from this, symptoms such as loss of appetite, weakness also join in. Swelling may appear on the face or on the lower limbs. Confirmation that a person has indeed developed pyelonephritis will be a visit to the doctor, who will prescribe an examination. This is an ultrasound of the kidneys, a kidney ultrasound, and definitely a urine test, which should show few. In almost 100% of cases, I'll elaborate on this a bit later, the presence of leukocytes. This allows for differentiation or selection between pyelonephritis and other diseases because inflammatory changes in the kidneys, such as pyelonephritis, are almost always accompanied by an increase, or in fact the presence, of leukocytes in the urine. I would like to say that leukocytes do not always appear in the urine. Sometimes with a specific type of pyelonephritis, such as obstructive pyelonephritis, that is when the kidney is blocked, for example, by a tumor or a stone, despite having all the symptoms of pyelonephritis, and we understand that it is pyelonephritis, we do not have leukocytes in the urine because they simply do not mechanically enter the lower urinary tract, and we cannot collect a sample. But this is more related to the surgical aspect of this process. And of course, when the kidney is blocked, when urine is not excreted from the kidney, here we are gradually approaching treatment, not only with some conservative methods, but rather with surgical ones. That is, the kidney needs to be drained. It is essential to establish urine flow, and then the inflammatory agent, exiting the kidney, will cause less harm than what we anticipate when the kidney is blocked.